Bismillah ar-Rahman ar-Rahim. Welcome to my channel Science of Life with Dr. Mohammed Yusuf. Today I am going to talk about the circulatory shock, the second part of circulatory shock. That is, we will talk about mainly some classification and some description of those special shocks. But before that, I would like to quote हदीस फरमान रसूल सल्लल्लाहु अलैहि वसल्लम. उनका फरमान है खैरुकुम मन तअल्लमल कुरान व अल्लमहु. ये सही बुखारी शरीफ में हदीस है. बुखारी is the most authentic book of hadith. Hadith is the saying of our Prophet सल्लल्लाहु अलैहि वसल्लम. खैरुकुम मन तअल्लमल कुरान व अल्लमहु. तुम में से अच्छा वो है जो कुरान सीखे और फिर सिखाए. तुम में से बेहतरीन वो हैं जो कुरान का इल्म हासिल करते हैं और दूसरों को इसकी तालीम देते हैं. ये खैरुल अमल है. कुरान अल्लाह पाक की लास्ट रेवलेशन है. इंसानों की हदायत के लिए अल्लाह पाक ने आखिरी पैगंबर पर जो हदायत की किताब नाज़िल की है वो कुरान शरीफ है. और उसको सीखना और सिखाना ताकि इंसानियत उस पर अमल करके दुनिया की और आखिरत की फलाह की हकदार बन जाए. अल्लाह पाक हमें समझ अमल की तौफीक दे. So we are talking about the shock. We defined it. This is the definition. The depression of the body functions due to the reduced blood flow to tissues because of some disorder of the cardiovascular system. And the cardiac output is reduced usually and blood pressure is reduced usually. There are some conditions in which the cardiac output may be high but the person is still in shock. This is the brief definition of this shock. Circulatory shock is generalized inadequate blood flow throughout the body causing tissue damage. This decreased blood flow to all the body tissue damage may occur. So we describe the shock. We are going to again describe that, some parts of that. Again, we are going to repeat that. But the different types of shock which we come across. Hypovolemic shock, some features of the hypovolemic shock we discussed in the previous lecture. And this is probably very common shock. Usually it is due to the blood loss and maybe fluid loss or dehydration. Hypovolemic shock. Then there is another shock, neurogenic shock, in which the sympathetic system is inhibited. Vasomotor tone is blocked. So that will result into the severe vasodilatation and the shock will occur. And then anaphylactic shock, which is also known as histamine shock. This is due to some allergy in which there is a release of large amount of histamine throughout the body from the mast cells or basophilic cells, and the histamine is a very powerful vasodilator. So their vasodilatation throughout the body may occur and the person will go into shock and death may occur. Then if there is some infection, sepsis throughout the body, sepsis somewhere, and this sepsis is present many parts of the body, or it may be spreading through the blood and generalized infection throughout the circulating, and there is severe infection throughout the body, and it may cause some toxins may be produced which may be vasodilator, but all that will lead to the shock, blood pressure fall, and metabolism still increases during infection. And then the cardiogenic shock, the very common cause which we discussed in the disease, that is the myocardial infarction or coronary artery disease, we discussed it. And anything wrong with the heart, whether it is the coronary artery disease or valvular disease or some other abnormalities of the heart causing something wrong with the heart itself, so it is cardiogenic shock. So we are going to touch some of these classes of the shock. Hypovolemic shock, the most common cause of the shock is usually the hypovolemic shock. We discussed it. One of the major cause of the hypovolemic shock, most commonly met condition is the hemorrhage, excessive bleeding due to any reason, or other trauma to the other body tissues. Dehydration, and we discussed it. Dehydration may be due to diarrhea, dehydration may be due to vomiting, or it may be excessive sweating. A lot of fluid is lost, and the fluid reduction means blood volume reduction as well. So there will be a fall in the blood pressure and cardiac output, etc. Shock will occur. Or Addison disease, a disease of endocrine disorder in which there is the absence of aldosterone, and aldosterone is the very important hormone responsible for the conservation of salt and water in the body. If in Addison disease there is absence of the aldosterone, so lot of sodium and water is lost in the urine, and that causes hypovolemia, reduced volume of the whole extracellular fluid volume, and the blood volume is reduced. So Addison disease is also one cause of the dehydration. Then diabetes, some people, the diabetes have got the excessive urination. Diabetes mellitus, excessive, a lot of fluid is lost, and that also causes diabetes causes two extracellular dehydration as well as the intracellular dehydration. So there is loss of the fluid. Simply, and diabetes as well, and the person may go into shock if excessive urination is occurring, but the person is not drinking water. Dehydration chances are very much there, and the less intake of water due to many other reasons. There are people who don't have desire to drink water, even they are dehydrated. Something wrong with their nervous system, the mechanism of the thirst stimulation. Many elderly people may have got the this reduced desire to drink water, even they are dehydrated. So this is another cause of the dehydration, less intake of water. And then 1, 2, 3, dehydration, several causes of dehydration, and fourth, burns. Burning causes excessive dehydration. Burning, skin is burned, and there is a lot of fluid is lost from the skin as well. And that, so burn is important cause of dehydration. So hypovolemia may occur in all these conditions. And we discussed this, the reduced blood volume will reduce the mean circulatory filling pressure. With this we have talked it, and you must be understanding that reduced blood volume causes mean circulatory filling pressure to be reduced, and this will cause the decreased venous return. You can add one more bullet here, that is mean circulatory filling pressure reduction causes reduction in the venous return, and then there will be reduced cardiac output and reduced blood pressure. And this inadequate blood flow to the peripheral tissue because of this fall in the blood pressure. Fall in the blood pressure, there is reduced blood flow as well as reduced pressure to push the nutrients into the certain pressure is required for the proper supply of all the nutrition and oxygen across the capillary. So that pressure is reduced, and the inadequate blood flow to the peripheral tissue. And the features are, when blood pressure falls, there is stimulation of the sympathetic system, and the pulse is rapid pulse, but because of the decreased blood pressure and decreased pulse pressure as well. Difference between the systolic and diastolic pressure is reduced, and that volume of the pulse is very low. Pulse at radial pulse or any other pulse you feel, volume is low. The pulsation is pulsating artery with the small volume increasing, small decrease, and this is known as thin thready pulse. False tachycardia is there. The pale, clammy and cold skin, we had discussed it in previous lecture. Sympathetic stimulation is responsible for the cold skin, vasoconstriction, clammy skin, sweating, and the pale skin because of the decreased blood flow to the skin. Skin vessels are constricted completely, and the skin becomes pale, so that the blood is distributed to vital organs, and there is increased respiratory rate. And restlessness because of the something wrong with some reduced blood flow to the brain, and this we have talked about, that is percentage of blood loss resulting into this reduced cardiac output and reduced blood pressure. Blood pressure is better maintained as compared to the cardiac output, and this is that area where the CNS ischemic response is responsible for some maintenance. Blood, if it doesn't go up, then the person is going to into the irreversible state and the shock will occur. The compensatory mechanism, we discussed it. With this slide, I'm going to just simply pass. That is, the compensatory mechanism include, that is, the baroreflex and chemoreflex and CNS ischemic response, sympathetic stimulation, and all leading to increased blood pressure because of this, because of the sympathetic stimulation, and more effective sympathetic stimulation, more effective in maintenance of the arterial pressure than the maintenance of the cardiac output. We saw this in the previous, that is this. No, sorry, but I would like to show the diagram again because of the last statement. That is, sympathetic stimulation is more important, more effective for the maintenance of the arterial pressure. Arterial pressure is maintained for quite long time, but this blood fall in the cardiac output, if 20% is lost, cardiac output is reduced, much reduced, and maybe only 75% is left, but the blood pressure is still at normal 100 millimeter of mercury. So this sympathetic stimulation is more effective in blood pressure maintenance and the less effective in cardiac output maintenance. The intact sympathetic system, this we had also discussed in the previous, this is again the slide from the previous lecture. Intact sympathetic system is very important for the outcome of the shock. That is, 30 to 40% of the blood loss may be compensated by the sympathetic stimulation. But if there is sympathetic system is blocked or it is absent, it has been blocked, then the only 15 to 20% loss of the blood may become lethal. So sympathetic nervous system is activated within a very short period of time after shock develops, within seconds, 30 seconds. So compensatory mechanism, other intermediate mechanisms are also important for the capillary fluid shift and renin-angiotensin system and the vasopressin and the renal body fluid system for the blood volume. Yeah, this intermediate mechanism. Then the kidney is responsible for it, more absorption of the fluid from the intestine as well. This is again some compensatory mechanisms as well. Now the coronary and the cerebral blood flow is well maintained. This we had discussed, effectively maintained, less vasoconstriction by the sympathetic nervous system, and local autoregulation is excellent in the brain and the myocardium as well. So at arterial pressure below 70 millimeter of mercury, even the cerebral and coronary blood flow is reduced. If the blood pressure is falling at 70 or below 70, the cerebral blood flow and the cardiac blood flow is also cannot be properly regulated, cannot be maintained. So arterial pressure at different, this we have seen. This is the non-progressive shock, the compensated shock, and this is the progressive shock, and this will cause the it may go into irreversibility. Non-progressive curves, and these are the progressive shock. This we have seen. Critical degree of this also we discussed it, that a critical pressure determines the final outcome of the shock. In dogs, 45 millimeter of mercury pressure has been seen to be recovered by all means. But if the pressure falls below 45 millimeter of mercury, it may very quickly progress to irreversibility, and the dog may die, or in human being as well, the person may. Shock itself breeds more shock. This diagram, complicated diagram, vicious cycle. Many conditions, all these conditions are worsening the condition. All these conditions decrease nutrition to the tissue and intravascular clotting and decrease cardiac activity. All is causing the decreased venous return, further decrease in the venous return, and further cardiac depression. It will bring more shock. So this is some important progressive cardiac depression due to the decreased blood supply, and the vasomotor failure because the decreased blood supply to the brain. When that fails, then sympathetic system cannot be activated. When even CNS ischemic response fails, CNS ischemic response will fail if the vasomotor failure is there. Then the blockage of the small blood vessel will cause the clogging of the blood vessels, and the venous return will be further reduced due to the sluggish blood flow. And the increased capillary permeability because of the excessive pooling of the blood, cardiac failure is taking place, or the blood is being pooled, it is not properly drained by the veins, venous drainage has been reduced, so capillary permeability by toxins or vasodilators or simply vasodilatation will increase the capillary permeability, and the edema may occur due to the hypoxia. There is local damage to the endothelium, damage to the blood vessels themselves because of the reduction in the blood flow to the blood vessels themselves. उनको भी तो ब्लड कम मिल रहा है, तो दे आर सफरिंग एंड दे आर कंट्रोलर एंड दे कैन नॉट कंट्रोल, एंड एक्सेसिव लॉस ऑफ द फ्लूइड may take place there. And release of toxin by the any ischemic tissue, any tissue which is toxic, toxins are produced by the damaging or the deteriorating different cell functions. They produce some toxin, and those toxin, endotoxin, cause further cardiac depression or further reduction in the blood pressure. So these are the different cardiac output curves. That is the normal curve, and if the shock occurs after 2 hours, the curve may be here. After 4 hours, 4.5 hours, and it is the progressing to the irreversibility. Irreversible shock may occur. Generalized tissue deterioration also includes the acidosis. When the excessive accumulation of the metabolites is taking place, hydrogen ion concentration, carbon dioxide concentration may be increasing, and acidosis, liver cells are damaged. Many tissue damage, liver cells are damaged, deranged metabolism that will cause, and the failure of the active transport of sodium and potassium. Energy metabolism will be suffering, and the failure of the active transport of sodium and potassium. And this will cause the leakage of potassium into the extracellular fluid. Potassium is kept intracellular because of the active sodium-potassium pump. And then when there is failure of sodium-potassium pumping mechanism, energy mechanism, then the potassium may leak out or sodium may go into the cell. So leakage of potassium into the extracellular fluid, accumulation of sodium and chloride in the intracellular fluid. When the membrane transport has been disturbed because of the shock, because of the reduced energetics in the cells, so this will cause the potassium coming out and sodium and chloride going in. So all the homeostatic mechanism across the cell membrane, they are disturbed. So the depressed mitochondrial activity, energy metabolism, and this will widespread lysosomal digestion. And when the cells are being damaged, it is the function of the lysosome to remove these damaged debris of the cells. So lysosome cause the killing of the digestion of the cells, which is known as the autolysis or hydrolysis of different parts of the cells. Proteins are being digested, or carbohydrates, fats are being digested away. So lysosomal enzymes become more active because of the degeneration of the cell or deterioration the functions of the cells. Deranged nutrient metabolism, they are not properly being metabolized. Hormonal derangements also occur, and the tissue necrosis, death of the tissues may occur. So these are the worsening condition in the causing the irreversibility of the shock. If you give the blood to this person in which the liver damage has occurred, the mitochondrial damage has occurred, membrane phenomena has been deteriorated, so simply replacement with the fluid or the blood and lot of pressure may rise, but it will go again. The cell death is taking place. What can we do about this necrosis? So irreversible shock will occur. This is irreversible shock, this state of this. So the worsening condition, it may progress. Here, if you treat, it will be okay, but you can't treat it. If it has level, it has gone to this. Excessive fluid intake or blood transfusion will not correct it. So now, this was about the general shock. Hypovolemic shock, we discussed it, but it can be applicable to other types of the shock as well. Other types, very important other types of the shock, that is the increased vascular capacity. We discussed in more detail hypovolemia, reduced blood volume causing a reduced venous return, total volume is reduced. Now the volume may be the normal, but the vascular capacity increases, the result will be the same. almost the same. And increased vascular capacity may occur due to the neurogenic shock. What is that? Neurogenic shock. For example, general anesthesia. If you give general anesthesia, neuronal system is blocked. This sympathetic system is spinal system. The preganglionic neurons are present in the spinal cord. If you block the transmission from these preganglionic neurons, sympathetic system is completely inhibited. So general anesthesia and spinal anesthesia as well may cause the neurogenic shock. Blood pressure may fall. And spinal anesthesia. General anesthesia as well as the spinal anesthesia may cause the depression or the blockage of the sympathetic nervous system, and it is absence of sympathetic nervous system causes vasodilatation, because vasomotor tone is lost. So that tone is absent, so there will be generalized vasodilatation. So the vascular capacity will be more, blood volume may be the normal, but the result will be as if there is hypovolemia. So the ischemia of the brain causing vasodilatation. If there is some ischemia to the brain, vasomotor center may fail and it cause the vasodilatation. This may be included in neurogenic shock. Or vasovagal syncope is one example of the neurogenic shock. Nervous system responsible for something wrong with the nervous system causing shock, vasovagal or emotional fainting. This is vasovagal syncope is emotional fainting. Emotional fainting may cause the cause of this is the stimulation of the vagus nerve, and it will cause the bradycardia and reduce cardiac output, and shock will occur. And postural syncope, postural hypotension. In some people, especially in elderly people, the barrow reflexes are not very powerful, are very quick. Then the person may be having some fainting or hypotension during changing posture, especially from lying posture. When the person stands, that there may be some reduction in the blood pressure. All these are the neurogenic shocks. The cause is nervous system. And the carotid sinus syncope. Carotid sinus, here, if you have, some person has got the tight collar, there is pressure over the carotid sinus. So carotid sinus baroreceptors are stimulated, and they feel that his pressure has increased. So they will send inhibitory signal to the vasomotor center, and the vasomotor center will cause the inhibition of the sympathetic system, and that will also reduce the blood pressure. So the carotid sinus syncope, suppression over the carotid sinus because of the tight collar or any other reason, and then the carotid sinus, pressure over the carotid sinus will stimulate the baroreceptors, and they will send inhibitory signal to the vasomotor center, and the sympathetic system will be inhibited. The person may go into shock. So all these, they lead to vasodilatation, and vasodilatation means increased vascular capacity as compared to total blood volume. Now, next, anaphylactic shock is another shock in which the vascular capacity is tremendously increased. Anaphylaxis, as you know, is a very severe allergic reaction. Exaggerated allergic response. Antigen-antibody reaction leads to reactions with the histamine secreting cells. Those are the mast cells and the basophilic cells in the blood, and all those produce large amount of histamine, which is suddenly released, plus there may be some other vasodilators are produced. So in this allergy, very large amount of histamine is suddenly released into the circulation, and that causes generalized vasodilatation throughout the body very quickly. Within maybe seconds, generalized vasodilatation will occur, and this increased vasodilatation is dangerous. It is causing the low blood pressure because of the total vascular capacity is more, and mean circulatory filling pressure is tremendously reduced, and the mean circulatory filling pressure is the force which forces the venous return. So reduction in the mean circulatory filling pressure will cause severely reduced venous return, and that will reduce the cardiac output. So cardiac output is reduced and blood pressure will fall. Plus, This vasodilatation also increases the permeability of the capillaries. When the capillaries become more permeable, there is exudation of large amount of the fluid, and with this fluid exudes out and total blood volume is also reduced. On one hand, there is increased vascular capacity. At the same time, there is reduction in the blood volume. So this causes severely reduced blood volume to total vascular capacity ratio of the blood volume to total vascular capacity is tremendously reduced. That is, vascular capacity is too large and blood volume is reduced to very low level. So this causes the shock, which is known as anaphylactic shock, because of the increased vascular capacity. Then another shock, which is again the example of the increased vascular capacity, septic shock. Sepsis means infections, severe infection anywhere in the body. Those bacteria and damaging bacteria and tissue damage by the bacteria, this causes bacteria produce toxins, and there may be some production of the vasodilators by the damaged tissue. Infected tissue may produce some vasodilator, but especially the bacteria, if the infection is very severe, large number of the bacteria may cause the production of several types of toxins, and those toxins may be some of the those toxins are vasodilators, and this causes the vasodilatation throughout the body, and this vasodilatation causes the ratio of the blood to vascular capacity reduced ratio, and this will cause the these toxins may also cause the weakening of the myocardium. Weakening of the myocardium is the cardiogenic shock, but this septic shock, weakening of the myocardium also may result because of these toxins from the bacteria. So on one hand, the total vascular capacity is being increased and the heart is being weakened by these toxins. So the capillary permeability may be increased by these toxins, like we saw in the anaphylactic shock. So capillary permeability, if it is increased, there is exudation of the large amount of the fluid into the interstitial space, into the extracellular extravascular space, and this exudation of the fluid, further reduction in the blood volume will occur, and again the result is decreased blood volume to total vascular capacity. So this is septic shock is also increased vascular capacity type of shock. Now, cardiogenic shock, another type of the shock. Cardiogenic shock, as the name is showing us, it is something wrong with the heart. And very common cause of the cardiogenic shock, as you know, is the coronary artery diseases. We discussed it. So cardiogenic shock, decreased pumping ability due to the infarction of the muscles. Infarcted muscles, damage to the muscle, reduces the force created by the contraction or systole of the heart, and this will decrease pumping ability of the heart. So dead portion of the heart cannot contract, and some tissue around that may be also be weakened, and this portion stretches out. The dead portion is replaced by, we had discussed in the previous one lecture, probably in the coronary artery disease lecture, this dead portion is replaced by the fibrous tissue, and this does not contract. And when the heart goes into systole, this non-contractile portion will be bulging out, which we term as the systolic stretch. This is known as systolic stretch. So with the passage of time, this with every contraction, this part will be stretching out, it will be bulging out, systolic stretch, and with the passage of time, there is more thinning of this part. This area of the damaged area or the fibrous area becomes thinner and thinner, and finally it may rupture. So this systolic stretch may cause the further pumping ability is reduced because of this stretch, and the heart failure may occur. Heart failure is when heart is not capable of supplying the adequate amount of the blood. Last two lectures we discussed it, and the heart failure and the peripheral ischemia will occur because of this heart failure. What is the heart failure? It is the reduced blood flow to generalized tissues of the body, causing the deterioration of the functions of the most of the tissues of the body. So peripheral ischemia will occur. All this will lead to what we term as the cardiogenic shock. Pumping ability has been reduced, and the heart has gone into failure, and with this bulge may rupture. We are going to see next. This but systolic stretch may cause the this heart may bust. So 85% of the people going into the cardiogenic shock may die. That is very large proportion of this cardiogenic shock patients they die. 85% is very large proportion. So this is that systolic stretch. When the heart is damaged, myocardial, the muscles are damaged here. They are replaced by some fibrous tissue, and during contraction, this part cannot contract, and this part will bulge out. And bulging out is known as systolic stretch. We are going to discuss again and next slide this gradual thinning of this portion of the heart may cause the final, it may burst into the pericardium. So this is the systolic stretch. So many ischemic heart disease patients, they die of sudden ventricular fibrillation. We talked in previous lecture में this death was due to the cardiogenic shock. Yes, of course, this is the shock, peripheral tissue and heart failure, and there is generalized ischemia causing the death. But sometime in this cardiogenic shock or the myocardial acute AMI, the death may be due to the ventricular fibrillation. This is another cause. Ventricular fibrillation, when there is damage to the myocardium, there may be production of abnormal impulses, abnormal electrical activity generated from this damaged area, which may cause the generalized fibrillation, that is synchronous contraction of the muscle may not be possible, and ventricular more chances in large infarction. This ventricular fibrillation, if there is large area of infarction, small area of the infarction is very quickly recovered, but the large area of infarction may lead to the ventricular fibrillation and can develop in even small infarction, but usually it is in the large infarction. Sometimes even after many days of infarction, this has been observed. That is, if there is large infarction, so the patient is recovering, and but suddenly the person goes into the infarction. So this is another cause of the cardiogenic shock, is the ventricular fibrillation. Then the infarction, after a few days, the degeneration of the infarcted muscle is replaced by the fibrous tissue. I have explained it. And the thinning of that site, that systolic stretch site, will be thinning with the passage of time. And the systolic stretch, with each contraction, worsening of the systolic stretch with the passage of time because of the thinning of that area. And this will cause the rupture of the heart. So rupture of the heart is the quick death. That is very collection of the blood in the pericardial cavity, and the pumping ability will be lost and out of. So the cardiac tamponade, this is collection of the fluid in the pericardium, is also known as cardiac tamponade. We had discussed in the previous lecture as well. So this will cause very quick death in the cardiogenic shock. Another now so we discussed it, hypovolumic shock. Then we discussed the increased vascular capacity, the anaphylactic shock, and the septic shock, and the neurogenic shock, and the cardiogenic shock. These important types of the shock we have discussed. So what should be the treatment of this shock? This is not in our scope. This is beyond our scope. In physiology, we don't discuss the treatment or the method of treatment, but the physiological basis of treatment we can talk. Treat the cause. If the cause of the shock is known, that cause has to be treated, and usually quick. We want to maintain the blood pressure. So blood pressure we want to maintain the blood volume, or we want to increase the total blood volume as compared to the vascular capacity we have discussed it. So the blood transfusion is usually given in these. Plasma transfusion may be given, or the transfusion of the plasma substitutes may be given. And the plasma expanders like dextran and the concentrated human serum and the hypertonic solution, we are treating this decreased hypotension. decrease blood pressure, we are treating by all these substitutes. And then we can give the sympathetomimetic drugs, the drugs which increase the sympathetic activity, and that will increase the force of the contraction, rate of the contraction, vascular capacity will be reduced, venoconstriction and vasoconstriction, increasing the peripheral resistance. So sympathomimetic drugs you will discuss in your third year classes when you study the pharmacology. What are the sympathomimetic drugs? And the glucocorticoids, we talked about the treatment of the shock as well. We can give not the treatment of heart failure, we can give. So glucocorticoids, and the oxygen therapy, and then the postural therapy, we know it, and the complete bed rest, all that. This is beyond our scope, but simply a few things about the treatment of the shock and postural changes. We know if we want to maintain the blood flow to continue to the cerebellum, we can raise the foot, and so that the brain doesn't suffer from ischemia, etc. So that's about the treatment of the shock. With that, we come to the end of this cardiovascular system, circulation. Heart and circulation, we have discussed it. Next time, inshallah, I'm going to start another system. Maybe for the first year MBBS, I may discuss the respiration, or I may discuss the blood. We have not discussed the hematology. Next time I am going to start some new system. And please do subscribe and share this video to the most of the students. And thank you very much. Hope to see you after some days.